President Biden has declared June a national month of action, organizing an all-of-America sprint to get more people vaccinated against the coronavirus by July 4th. Experts say a person who's had COVID-19 still needs to get vaccinated against the disease, noting that the immune response after having the disease is not as strong as the defensive response that occurs after vaccination.
There are common side effects after getting the coronavirus vaccine, but what can happen if you previously had COVID? Morning anchor and health reporter Kirsten O'Connor is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
And while it is rare, studies show that it is possible that patients may experience some inflammatory stress after a COVID-19 vaccination, especially if they've had a previous COVID-19 infection. So joining me now to talk about this is Dr. Jason Littleton. He's an MD, CEO, and co-founder of Littleton Concierge Medicine. And we're so happy to have you live in the studio for the first time in a very long time.
Thank you. Glad to be here.
And so let's talk about this inflammation after having the COVID-19 vaccine. Why is it that patients who've had COVID-19 are seeing this pop up?
So there's a thought here that people who've had natural COVID infection, they're viral proteins that can remain in tissues of the lung, tissues of the brain, so that when someone gets vaccinated again, the immune response can be reactivated and sometimes trigger a thromboembolic response. And so that's a concern. We've seen people who've had blood clots, and recently, with the J&J vaccine, people who had, what is called a blood clot that's actually in a blood vessel of the brain, okay? And this is something that has been very concerning. People have been concerned that maybe we need to think back. We need to think again, if you've had a natural COVID infection, maybe you only need one shot.
And so I think a lot of people are familiar with the Johnson & Johnson news and the blood clots, but some people may not realize that there are scans that are popping up and they're showing maybe something that's not there because of this inflammation. Can you talk a little bit about that?
Yeah, definitely. So this is in regards to mammograms. There's this thought that, when you get a COVID vaccine, what's going on is that sometimes people have lymph adenopathy, and this lymph adenopathy could be concerned for like a breast lump or a breast cancer. So people are concerned, they're worried, they go ahead and get a mammogram, and they realize that, that's not what it was. It was more related to the COVID vaccine, and this is not, an actual breast cancer concern. But if you have any type of concerning lesion, this is something that you should still get checked out by your primary care doctor. You should still go ahead and have the mammogram. But the people are saying that you should delay getting a mammogram until after you've had the vaccine, so that you wait, so that there's this distance of time. And so this can help eliminate some of the discrepancy.
So where on your body would that inflammation be happening? Like if somebody is starting to get concerned about it, can they do a self-check?
Well, of course, we always recommend that women do self-breast exams. But this lymph adenopathy could happen around the breast or in the axillary or armpit regions. So this is something that people, when they first see a lump in that area, they do get concerned. And so this is why we always say, if you're going to get the vaccine, why don't you have the mammogram first and then get the vaccine, or wait after, so that there's this distance of time.
Okay. What about other vaccines? I know that, my daughter just had her 4-month vaccine, so I'm thinking about that. But, if anyone is signing up for vaccines that they need to get regularly, can that also cause inflammation? Is this new to the COVID-19 vaccine?
Well, vaccines in general can cause inflammation. They can cause soreness. They can cause fever, local reactions. But what we're focused on here is the COVID vaccine, and this is something that's become more apparent recently, and that's what's been the issue as of late.
Would you call this a side effect, or would you call this just something that we see after getting a vaccine?
Well, it's really not a side effect. It's more of just the immunologic response. And so this is the body just revving up to protect yourself in case you do get exposed by COVID. And so this is something that is a natural response. But if people do have anything that is more alarming, they should definitely let their primary care doctor know.
Right, and that's how, everybody who has gotten a vaccine is pretty familiar at this point that there are ways that you can self-report something that's a little unusual, but it's important to follow up with your doctor.
Yeah, definitely. And I've had my own patients, they've come and told me, they said, hey, Dr. Jason, I got the vaccine today, here's my vaccine card, but I've had maybe this side effect or that side effect, or this is concerning. And it might not be related to the vaccine at all, but it's something that we monitor, we watch, and we try to see if we can correlate it. One thing I wanted to bring up was that there's a Penn study out, University of Pennsylvania, that say that, people who've had COVID infection before, natural COVID infection, they may only need 1 shot as opposed to 2, because the thing is that they're memory B cells, and you've got antibodies that are already there, and that immune response is actually very sufficient.
And so that's something you could ask your doctor about, I'm sure.
Exactly.
All right, that's why we do this segment. Hopefully we get more people inspired to have those conversations. Thank you so much, Dr.
Thanks
Littleton.
for having me, Kristen.
It's great to have you here.